Hello, and welcome to the Voice of Rio Grande. I'm Craig Klein, the Dean of Community College Programming at Rio Grande Community College. I'm very pleased today to welcome my guest and a third party to the table. This is Mr. Rick Wisecup, and Rick is the Training Director and Field Supervisor for the Jackson County, Ohio Emergency Medical Services. Welcome to the show.
Well, thank you very much, Dr. Klein. And this gentleman right here, or this person right here, is Carl.
Okay, Carl is the strong silent type?
He is the strong silent type. Actually, he is one of our Airway trainers that we use for our EMT and advanced EMT classes.
Okay, and we'll be seeing Carl and perform, I suppose.
Yes, we'll go over
see how
some
Carl
things
is
we
used
do.
in the process.
Yes.
So again, welcome to the show.
Well, thank you very much.
So we're going to talk today about EMT, which is Emergency Medical Technician.
Yes.
And that's a program that we offer at Rio Grande Community College. Specifically, we have courses at our location sites, particularly Jackson, and in the fall, MacArthur as well.
Yes.
So I'm going to start and just asking basic questions. So EMS, Emergency Medical Services, is a relatively new field, career field?
Yes, it is, as it is today. Okay. When we look at EMS in the past, a lot of that in the 50s and 60s was run by your funeral homes, or maybe volunteer fire departments.
Okay, well, let's take a look. I know we have a picture of a quote-unquote older ambulance.
Yes.
Let's take a look. And there we go.
Yes.
You know, I can't help but notice, other than it's in black and white, it's radio equipped. That's always good.
And the big thing, oxygen equipped.
Oxygen equipped. Well,
yes.
Well, there you go. So you can have air and
broadcasting.
Air
and broadcasting, yes. Well, so they could radio into the hospital and tell them they were bringing someone in.
Well, it looks like a hearse to me.
And it is. It's a converted hearse. They would take hearses out of service, put the lights and siren on, and then use them as ambulances.
Okay.
At that point in time, the people were trained very rudimentary first aid, and they would rush to the accident scene or the emergency, put that patient in the back, and rush them to the hospital with very little treatment en route.
Okay. Well, from here, we I guess you can only go up.
Yeah, there you go.
And so here is a more modern, in quotes.
Yes.
One, we have the color red. This looks like a Cadillac.
That's a Cadillac, yes.
Okay. And
still the same thing there. It was throw the person in the back of the ambulance and get them to the hospital as quickly as possible.
And what did the back look like? Let's take a look at that. Okay, fairly Spartan.
Yes.
And the padding on the sides.
There in case there would be an accident.
I say in case you'd have an accident in the ambulance. Okay.
As you notice, there's not a lot of equipment there.
Okay. Where are we, in the late 60s, early 70s?
That is probably late 60s.
Okay. Okay, very good. So I understand that Jackson County EMS, or can we say JSEMS?
Yes.
Okay. Is a joint EMS district. And
well,
it's one of only a handful in the country?
Well, it started out, excuse me, it started out as a joint EMS district. Southeast Ohio Emergency Medical Services. This was back in 1973. During that period of time, the Department of Transportation found out that it would be best to treat these people, get them started with treatment that would be started in the emergency room, pre-hospital, and then transport the patients to the hospitals. So the training developed where EMTs are now the current emergency medical technicians, paramedics, the advanced EMTs are trained to administer far greater aid than what they did in the past.
Okay, so for those of us of a certain vintage, we may remember a television show, I think it was called Emergency.
Yes. Yeah.
And so basically they were paramedics.
They were paramedics, yes.
But they were always on the whatever kind of radio, it was a big radio in size, they were always calling the hospital and asking for what to do.
Right, asking for permission.
Asking for permission to do whatever treatment that seemed appropriate.
Well, now with the modern training, we teach our people that they follow protocols, set protocols by a medical director or doctor. So these people do not have to be on the radio all the time requesting,
Okay.
you know, what needs to be
They
done.
have a certain level of autonomy
Yes.
during the decision-making process?
That they can decide on their own the proper treatment for that particular patient.
Okay. Is that courtesy also extend to basic EMT
Yes.
graduates when they finish a program?
Yes,
Okay.
there's certain things that they can do, and a lot of it has to do with the protocol from the particular organization.
So the current status, if you will, if you're going to be an EMT, we have basic and we have advanced, and then you move to paramedic.
Paramedic,
after that.
yes.
So this would require, I'm guessing, a license? Or
Yes,
some kind of a certification?
it's a certification through the state.
Okay.
To achieve that, you have to, of course, have the initial course. Then you are, once you successfully complete that course, you can take a certification test, which is the national registry for the state of Ohio.
Okay. And how long is, assuming you pass and all goes well, how long is that valid? You have to renew it periodically?
The national registry you renew every 2 years. State certification is renewed every 3 years.
Okay, good. So the current occupation of this, occupational status, I guess I would say, is that a person could find employment upon completing a basic class?
Yes.
Okay. And the key question, could they find employment, broadly speaking, in southeast Ohio?
Oh, yes, yes. If you can look at, there's private services who do a lot of ambulance transport. This would be between hospitals, from hospital to hospital, taking people to their doctor's appointments. Also, they help in some places do emergency transports.
Okay.
Most of what you see, the 911, is usually run by a government agencies such as county or multi-county.
All right. So let's take a look at how point of first contact might be made. So we have a picture that illustrates loading, or the device that allows you to put someone into an ambulance, a current design.
Current design, yes.
Okay. Let's take a look at that one. There we go.
Ah, there it is.
There it is. Okay, so I'm looking at, it looks like a sort of collapsible gurney.
Yes, this is a power cot. It's made by a company called Stryker, and it's also a load system. In years gone by, the two EMTs would have to manually pick that whole cot and the patient up together, lift them into the back of the vehicle.
So literally heavy lifting.
Literally heavy lifting, and we noticed that there was a lot of back injuries because of that.
Okay.
With this system, this actually, the carriage comes up at the bottom. It's all done by a power, and we can push that patient just in with 2 fingers.
Okay. And there is another way to transport people besides ground-based vehicles.
Yes.
Let's take a look at that one. There you go.
Yes. That's your air medical.
Okay. And so when is this called into play as opposed to a ground-based ambulance?
If you have someone that is severely injured or meets a certain criteria, and this is all set by the state of Ohio. It's called Ohio Trauma Triage Protocol.
Okay.
When a person meets that particular protocol, they need to be at a multi-trauma center.
Okay.
Since there is not a lot of trauma centers in rural southeast Ohio, the person is transported to either Columbus or possibly West Virginia to one of the larger hospitals.
Okay. So in that helicopter, you would have at least one EMT?
Yes, you'd have
patient?
the patient, you would have a paramedic, and also a nurse.
A nurse, so you would have 4 people?
Yes.
In there? Okay, including the pilot.
Including the pilot,
Including
yes.
the pilot, okay. So in order to reach a point where one feels comfortable, coming to the aid of people, loading them into ambulances or helicopters or whatever it may be, and making these kinds of decisions, they need some training.
Yes.
And that's where our buddy Carl comes in.
Carl comes in.
Okay, so tell me about Carl and what he's used for.
Okay, Carl is our Airway trainer. He can be used for putting in advanced airways. And this is one of the airways that an EMT can, under certain circumstances, can use. So actually, with this, we train people how to properly place this device, when it needs to be placed, of course, and the indications and contraindications of using this particular device. This is called a Combi Tube.
Okay, so everyone can see this, I'm sure. Is this entire thing inserted through the mouth?
It's inserted through the mouth, yes.
Okay, and where is it on its way to?
Okay, actually, if it's done properly, this should go down into the esophagus, and you inflate both of these cuffs. Now, since it's a blind insertion, this could possibly go into the trachea. That's the reason for the two different ports here. So if it would happen to go into the trachea, we can just switch over to another port and ventilate that patient.
I see. Okay, very clever.
Oh, this is another called a King Airway. This is also inserted. This does not go into the trachea by any means. If it does, there is a problem inserting it. And what this does is close off the esophagus and prevent any type of vomit from getting down into or any type of emesis, I should say, down into the lungs.
All right. And you would use these when a person is unconscious, or
yes.
If you also see them struggling to breathe?
Yes, usually these are put in when a patient is apneic, when they're not breathing at all.
Oh, okay.
And this gives a more solid airway than just using, as it is.
So if we're not inserting these things, we're putting a mask on?
Yes. This is called a CPAP device. EMTs are trained to use this and when to use it.
Okay.
And properly installed, this will help a person that is in CHF or maybe
CHF
is chronic heart failure. And what happens in chronic heart failure is fluid builds up in the lungs and the person's unable to breathe. With this device, there's a positive pressure that goes in, keeps the airway open, and also helps push the fluid out of the alveoli in the lungs.
Okay.
Makes it easier for the patient to breathe.
Thank you. We're going to take a short break right now, and we will be back with more Voice of Rio Grande in just a minute. Hi, welcome back. You're watching the Voice of Rio Grande. I'm Craig Klein, the Dean of Community College Programming at Rio Grande Community College. And my guest today is Mr. Rick Wisecup, who's the Training Director and Field Supervisor for the Jackson County Emergency Medical Services Team. And we also have with us Carl, of course.
Yes.
And when we left, we were talking about using a CPAP on Carl. And is this used for anything else? Is all airway training?
It's mostly all airway training. He has lungs that will inflate whenever the airway's put in properly. It helps us show that. We can also do CPR training on Carl.
Okay. So if one were to sign up for basic EMT training, one would get to meet Carl?
Yes, yes.
In a manner of speaking?
Yes, yes.
Okay.
You get very familiar with Carl.
Okay. So we have basic EMT being offered at our MacArthur site.
Yes.
In MacArthur this fall. And so basic would include this.
Yes.
Okay. And obviously other kinds of training, because we've seen how people are loaded. And we've talked about the decision-making process that they go through.
Yes. There's a section of critical thinking that we try to impart.
Okay. And also in the fall, there will be lab classes or training classes at a facility, particularly student groups, cohort groups, that sort of thing.
Yes.
In addition to all of these hands-on objects. Let's take a look at the Emt Lab Picture. Okay. So tell me what I'm seeing here. What's happening to this poor person?
This poor gentleman right there. Sometimes we need to immobilize someone in the sitting position, say they're behind the steering wheel of a car. They've been in an automobile accident. The device that they're putting on right now is immobilizing that patient from the bottom of their spine to the top of the head. So they're properly installing that device So they can remove that patient or extricate the patient from a vehicle.
All right. Let's take a look at another one of EMT students. Oh, there he is again.
And there, yeah, this is a different
class. It must not be good.
class.
There are more people around him.
This is a different class with a different victim. And they're applying, you can probably see the device a little bit better. It's called a Kendrick extrication device, or a KED, that they're applying right now.
All right. And I'm guessing that he's also a student?
Yes, he's also a student.
Okay, so
yes.
students practice on each other.
On each other, right. So they know what it feels like to be put in the particular device that they're using.
I think that empathy is a good thing.
Yes, it is.
Okay. And we have one more, I think, also even a larger class.
Okay. Yeah, this is one of the classes that we brought in. It's Advanced Stroke Life Support, which trains us to recognize the signs and symptoms and to get these people with possible strokes to the proper facility as quick as possible.
Okay. Are they trained to the point where they can tell a TIA from a stroke?
Yes,
okay.
yes. Also, once we have this training, you can pretty much, without having a CAT scan, of course the person needs a CAT scan, but without having a CAT scan, you can say, okay, that is in the left hemisphere of the cerebellum.
That's remarkable.
By the type of things we do.
Even the basic students can
yes.
recognize that.
Yes.
That's quite a skill. So this fall also we're going to have advanced, correct?
Yes.
So without putting too fine a point on it, what does advanced train you to do that basic did not?
Okay. With the advanced, and through the state of Ohio, and the scope of practice has really expanded the practice for the AEMT. The AEMT can start IVs. They can administer medications under certain conditions. They can also do like a needle decompression of the chest for someone that has a tension pneumothorax, which is a collapsed lung. So there's a lot of things that we teach our AEMTs to do, almost to the paramedic level.
All right. So if I'm an AEMT, I'm guessing that in addition to the classroom work and the basic orientation to all the equipment and gear, this would also probably involve a lot of work as ride-along?
Yes.
Or actually being in emergency rooms?
Yes, yes. We do have hospital time. It's required. It's required by the state to have in-hospital clinicals. So they do the in-hospital clinical time and also actual ride-along time with the different ambulances.
They're engaging in the real thing, which is actually what they've been doing.
Yes.
But to either a deeper, I guess to a deeper level or a higher level.
Yes.
Because they're given more autonomy in terms of the decision making.
Yes.
Okay. Very good. Let's take a look at some advanced kinds of training. Okay. The first one, okay, we're going to Mars.
Yes.
Or this is Halloween dance-off. What is this?
Okay, this is some of the personal protective equipment that we use, which would be trained for all levels. This, at the one time a couple of years ago, was the CDC's recommendation for Ebola.
All right.
So what we have here is this young lady modeling this protective equipment for us here.
Okay, is there dedicated air supply to that as well?
No, she's using an N95 mask. It kind of looks like a duckbill there on the front.
It does.
And actually there's no self-contained breathing apparatus with that, but they found that just filtering would keep you safe from most airborne viruses and bacteria.
Is it conceivable that this would be used for things other than Ebola?
Yes.
Okay.
Yes.
And so what happens to a person who puts themselves into exposure to such things? Is this removed in some systematic destroying the garment way?
Yes, they're trained how to properly put it on and trained how to properly take that garment off without causing contamination to themselves or anyone else.
Very good. They also, the advanced folks also need to do IV kinds of work, and I think we have some pictures of that. Here we go.
Yes, these are some students actually starting them on our simulated trainers.
Okay, that looks like a disembodied hand.
Yes, it does.
I'm thinking back to the Addams Family.
Yes.
and
the thing.
the little
yes,
thing
yeah,
that was in a box all the time.
These are kind of like Carl, they're synthetic, but they do have veins. As you notice, the blood that's hanging there actually
Yes.
runs through that hand, so they get a realistic flashback of starting an IV.
Okay, and is that, I'm guessing, is simulated?
Yes.
Okay.
Yes, it's simulated.
Authentic, though.
Yes.
Authentic, and we have
Authentic looking.
We have another one as well. We have oh, here we are, more folks.
Yeah, there's more folks there
Okay.
trying their skills. And that's before we turn them loose on real people, they need to become proficient at starting an IV on the simulators.
Okay, and while we have this picture up, I noticed that there are a lot of different types of identifying clothing. Is there a standard uniform for this? Or a
well,
standard dress?
Actually,
I see at least three in the picture, three different kinds
actually
of
in
things.
Rio Grande, they do have a uniform that they should be wearing to class.
They should be, okay.
Yes. With this, we have various organizations right there, and they're wearing their identification for that particular organization.
So in the fall, we're going to have advanced EMT at our Jackson location.
Yes.
So both of these are, both the basic in MacArthur and the advanced in Jackson are semester-long.
Yes, semester-long programs.
So if someone is contemplating doing either of these things, how long should they think about devoting to this on a weekly basis? How many hours are they committing to?
Okay, as far as classroom time, it's 5 hours, or 4 to 5 hours in the evening per night. So you're looking around 10 hours there, but with doing the hospital time and study time, you would look at, they need to put in about 20 hours a week of time.
So altogether, it's approaching a full-time job.
Yes.
At some point, to do either of these.
To do either of those.
To either of those. Okay. We have two more pictures we'd like to get in. First of all, this is, what is this? Auto extrication?
Auto extrication, yes. This is with the help of the Wellston Fire Department.
Okay.
They brought in a vehicle that was already smashed up. We did not wreck this while we were there. We put a patient in there, or a simulated patient, and then we have the EMT students properly extricate that patient.
Okay.
You see that we have one of our instructors there, that's Bob Cornwell. If you notice, he's got the Jackson County EMS
Yes, I see that.
insignia on there. So he's one of our instructors.
Okay.
That's
so
helping with
students
this
learn how
class.
to properly take someone out of a car.
Yes.
I guess the assumption is, well, maybe not, that they're unconscious. They
Well,
could be unconscious.
they could be unconscious. There's certain ways of extricating someone that is unconscious. The certain ways of extricating someone without compromising their cervical spine, possibly causing
so, sort of a spine-friendly way
Yes,
to
to
gently
remove
somebody.
Yes.
And then we saw the ambulance in the back there. And all going well, we reached this point, at least in the 80s we reached this point,
Yes.
judging by the appearance of folks. So these are, is this a graduating class?
This appears to be a group that got their certifications, and they're there for their new EMS things. This is not in our area, but this is how we looked in the 80s.
Okay.
And this is our trained, we were out with being new EMTs, AEMTs, and paramedics.
All right. So, finally, what does it take to be able to even register for these classes or this training? So if folks are interested in this, what do you have to do?
Okay. If you're going to become an EMT, you have to have a high school diploma or an equivalency, and register through Rio Grande admissions. Part of what we have to do, and this is background checks. We do a FBI, BCI background check, also 18-panel drug test. Once these people successfully complete the class, as we said before, it prepares them to take the national registry so they can be state certified and become employed.
Okay. So first of all, you pass the background screening, that
Yes.
sort of thing, and the drug test.
And the drug
obviously.
test, yes.
Then you move on, take the class, and then you go for your certifications
Yes,
through the exams.
through the exams.
Okay.
Now, the advanced, a prerequisite is having the EMT certification.
Very good.
Okay.
And with that, I think we have a pretty good idea of what's involved, how one becomes interested, perhaps, in EMT work, basic or advanced, and what the opportunities are that lie in our region, and all from the Training Director and Field Supervisor for Jackson County EMS, Mr. Rick Wisecup. Thank you so much for being with us.
Thank you, Dr. Klein.
Appreciate it very much.
Thank
For
you.
the Voice of Rio Grande, I'm Craig Klein. Take care.